Hi, it's Dr. William. I want to talk about 15 things not to do after having liposuction. And we're not going to beat around the bush here. We're going to do this very rapidly, very quickly. Number one, don't forget to take your folate, vitamin C, and iron. Continue to do that all through surgery, including 6 months after having your liposuction. Number two, don't forget to make your purchases. Do this before surgery so you got everything ready. Don't forget to walk frequently. That's number three. Number four, don't forget to get massages. Now, 10 is the minimal amount you want to have. 20 is better than 10, but at least 10 massages. Number five, please talk to your caregiver. Tell your caregiver very openly, very honest, I'm going to be leaky, I'm going to be whiny, I'm going to be draining. You need to prepare them so that you don't have any conflict during your recovery. If you talk to one person and their face starts to be like, that doesn't sound good, then pick another person. You really want somebody that can really stand in there with you and help you. Number six, don't forget to build your nest before surgery. I'm not going to list all the things, but you're going to want to have blankets. You're going to have to be a comfortable location. I would pick out 2 locations because like when you have the flu and you lay in bed for 2 days and you're just dying to get out of your bed, you move to the couch, do the same thing, build 2 nests. You want to get the towels, the chuck pads, a lip balm, download some movies so you got something to do while you're recovering. You're going to think of it like it's a storm coming and you're going to be weathering that storm for about 3 days. Number 7, do not open up your incisions after liposuction. They're left open for a reason because the fluid's going to drain, but after 48 hours, those incisions naturally close. Don't let anyone else open them. That's how you're going to buy yourself an infection. We do not want that. Do not drink alcohol 2 weeks before, 2 weeks after having your liposuction. Number 9, do not smoke 1 month before having surgery and 1 month after surgery. Marijuana is fine as long as it's done in a way that's not adding nicotine, because the nicotine is where the problem is with the healing. Marijuana is actually useful post-operatively. It helps with nausea, pain, and anxiety as well, which could be a problem after surgery. Number 10, do not go swimming, do not go into any water, ocean, freshwater, pools, hot tubs, until all of your incisions are completely closed, because there's bacteria, there's parasites. Number 11, do not look for a revision at 1 month after having surgery. You may see something that you don't like, you may see something that's uneven, but 1 month is way too early to do anything because the tissue is still really hard, so you're going to have to wait for 12 months. Number 12, do not watch this video regular speed. Turn it up, go to the settings, put it at 2 times. This is going way too slowly. Number 13, don't wear a waist trainer over your faja after having liposuction. That is not a good thing to do. Over compression is a worse problem than under compression. You're better off to roll. People really just sleep on rolling. It's the most important thing to do. Number 14, don't wait to have exercise or sex after having liposuction. So if you have a tummy tuck, if you have a BBL, there are going to be limitations on what you can do. But if you have liposuction, there's actually no limitations on what you can do. You can do whatever you want as soon as you feel like doing it. And number 15, sorry, hang on, pardon me. Hello? No, I'm going as fast as I can. This is as fast as I can. Number 15, don't give up on your scars. I see this happen a lot. People will massage their scars for 1 month and then they'll think that's all that they can do. But no, the scars take 12 months to heal. You can impact that healing by doing massage 2 minutes twice a day for 12 months. That's how you're going to get the very best scars. That's all I have. Thank you very much for watching. Want to, like, subscribe, whatever like that.
Fuck something up. Better fucking something. I need some drink in my cup. Hey, I'm in the mood to fuck.
What's up, you guys? It's your cousin Krystal bringing you another video. And I don't know where to start, but we just gonna jump right on in. Before we get started, baby, I was a proud mom of a 2023 graduate. If y'all follow me on social media, on Instagram, you see that I have a son who is 18. This is kind of off topic, but hey, he's my world, okay? And he suffers with autism, intellectual disability, and speech delay. But you wouldn't know it until like he really started having a conversation with you. He's so adorable. So he had graduated, and I'm just still a proud mom, okay? Other than that, I have picked up some hobbies and interests, and I do stage play and acting now. So I went to rehearsal today and I wore my t-shirt, okay? But anyways, long story short, let's get right into this video. I'm gonna try to be as transparent as possible, okay? This is a part 2. Okay? I think I've been very open with pretty much everything that's been going on, okay? And Y'all see the thumbnail. So let's just go ahead and dive right on in, okay? Okay, so first thing first, I want to address some concerns, and most importantly, I don't want to forget the people that are actually suffering. You get what I'm saying? Because I don't want my message to be misconstrued. I want people to really understand that this is a concerning video, concerning, not discouraging, but concerning, not discouraging, okay? And I want to bring awareness. I want to bring awareness to the situation at hand, what's going on. At the same time, I feel like this should be an educational moment for a lot of you all. For those of you who are new to my channel, go ahead and press that subscribe button. Go ahead and thumbs up this video. Don't forget to turn your notifications on so you would never miss out on a live or a upload, okay? You'll be the first to know, okay? Always stay in tune with my community tab, where I sometimes, I don't know, I've been kind of forgetting about the community tab because I be updating my other platforms. And, you know, like, I'm just trying to stay in a loop with everything, and y'all be keeping me in a loop pretty much with everything. So basically, let's go ahead and jump right on into this video because I'm tired, okay? Okay, so first of all, I want to come back and I want to do a part 2 of this video because I don't think I made myself clear enough, okay? I really don't feel like I made myself clear enough for y'all. For some of y'all. I ain't gonna say all of y'all, but for some of y'all, okay? Now, it's one thing to be blindsided, and then it's one thing to be pre-warned, okay? Pre-warned, okay? And I say that to say, don't get me wrong. I know it's a lot of people who catch infections, okay? That's a given. But why do we have people blaming the patients all the time? Why? Why are we blaming the patients all the time? Infections can accrue from the doctor. It can accrue from aftercare, postoperative. It can accrue from the instruments. Any type of unsafe, unsanitized environment, you can accrue an infection. I think I had pinpoint a bullet where someone had marked in my last video. Basically, she was a nurse as well. And I think I highlighted her comment where she said that there are several different types of infections when it comes to postoperative aftercare. Once you leave the facility, you could have began to catch that infection leaving the surgery center. As you know, it has to go through its process. It can take anywhere up to 72 hours or even up to 7 days. And meanwhile, while it's taking 7 days, you're thinking, oh, it's something that you did. And come to find out, when you go to the ER, when you go to the emergency room after you felt like you having discomfort or you detected an infection, it is highly important that you automatically go to the ER. Once you go to the ER, of course, you're going to tell them that you recently had surgery. They're going to need to know that. You tell them that you recently had surgery. Next thing, they're going to go ahead and do some blood work, probably give you some IV fluids because you probably dehydrated, you probably very weak, you probably lack of nutrients, whatever. They just going to, you know, provide what they need to provide for you. Also, they're going to take, what did she say? What word did she use? They're going to take a sample, okay? They're going to take a sample of the culture of the infection so they can figure out what type of infection. You get what I'm saying? That's why I say we need to get educated on this, because it goes way beyond I went and had surgery and oh, I had an infection. Oh, I must have did something. And come to find out, you ain't did nothing, because this infection is internally and it's draining out externally. And it's turning into something, it's going way to the next level where it's starting to erupt your other cells and your body and everything, and it's just spreading, okay, at this point. So they're going to go ahead and take a culture, and they're going to do a sample so they can go ahead and do a biopsy and figure out what type of infection that you are encountering, okay? It's also been brought to my attention that my group on Facebook, which is called Cousins Plastic Surgery Group. Let's get this straight, okay? My group is not a competitor group. My group does not compete with anybody else's group, okay? Let's go ahead and lay down the pros, and we're going to lay down the cons, then we're going to go ahead and finish getting up into these infections, okay? I just need to go ahead and lay this out there, okay? Because today was... like y'all was bringing the smoke to my group today. Like y'all was really bringing the smoke. And guess what? I was there to let it out, baby. Yes, because we're going to lay down the facts and we're going to lay down the truth. People wonder why it's been brought to my attention from maybe like 2 or 3 people. Why all of a sudden people are opening up in your group talking about infections? Why is it that your group is the only group that are catching infections? Why is it that everybody is discussing infections in your group coming from smart? You know why? You know why? Because let me tell you something. I have an open door policy, okay? And one thing about me is I'm going to make you feel comfortable, okay? That's just me. That's just my energy. That's my vibes. That's my spirit, okay? And I don't know, people just gravitate to me. And I mean, that's nothing that you can, God favored me for that. You get what I'm saying? People gravitate to me. And it's never on a negative aspect. It's always positivity. It's always positivity. Now, we're not going to always agree to disagree in my group. We're somewhat going to always agree and disagree, but we're not going to always agree in my group. And it's okay. But you know why? Because we are grown women and men in my group, and we know how to talk. We know how to have effective conversations. We know how to communicate in the cousins group. You get what I'm saying? If something is bothering this cousin and they post it, let's address it. If somebody feeling offended in my group, we're going to address it. We do not just block people in my group. We do not just, if somebody come and they post something bad that happened to them, it can be from Dr. Triggs. I'm a Triggs doll. I'm a Cannon doll as well. And I'm a Simmons doll. So it can be from any one of my doctors. Let me tell you something. It's no favoritisms. It's no favoritisms. Because if Dr. Cannon out here giving all of these infections, I'm going to talk about it. You get what I'm saying? Now, it's one thing to, okay, this person have an infection in January, and then another person pop up maybe in September and have an infection. Okay, that's 2 people out of 6, 7, 8 months. But then you have this other facility where they're having 2 or 3 infections a week within the last 3 months. Okay, so let me not get off track. Let me back. So people keep wanting to know why people are being open now, being more open. You know why? Because I laid it out on the table. You get what I'm saying? I make people feel comfortable. I make them feel like they're at home. I make them feel like they can open up. You don't have to hide. You don't have to live in fear with your scars. We are all in this journey together. And let me tell you something. When I first came to my platform and Dr. Shanklin first came over there to Vixen, I was one of the first ones that brought him to YouTube. Go look me up. Go look me up. I was one of the first top 5 that brought Dr. Shanklin to YouTube. And then I was even advocating for him. I was advocating, baby, I go way back when Dr. Shanklin was over there at Bixen. Okay, I knew a new doctor was coming. I knew that Dr. Shanklin was coming. Okay, when that man came over there, I didn't put him out there in the streets like that. I wasn't bragging on him like that. You know why? Because I needed to research him. I needed to research Dr. Shanklin. I monitored him. I watched him. I paid attention to his patients and how he moved and how he communicate. And I talked to other dolls and cousins about his bedside manners. Let me tell you, this whole new Shanklin right now, I don't know what's up. I don't know what's going on with him. So that's why I say that to say this. People come to my group because they feel like it's an open platform. They feel comfortable. They don't have to feel like they have to shy away. They can feel open enough to go ahead and share their journey to prevent this from happening to the next person. You get what I'm saying? Now, I'm not hearing anything going wrong with his BBLs. I'm hearing it's a lot going on with his breasts and his tummy tucks. This is what I'm hearing. This is not rumors. If you want to join my group, come on my group. People are posting real live pictures, okay? People are posting real live pictures. They had surgery within the last 3 to 4, 6 months, okay? And people are coming forward. People are coming forward. What y'all think? Nobody was eventually going to talk? No, people are feeling more comfortable to come forward and voice their opinion on what's going on, how they feeling. People have real life scars due to this. Real life scars, mentally and physically. You get what I'm saying? And it hurts me. It really hurts me because I feel like Dr. Shanklin, I feel like he's not taking it to the next level. You get what I'm saying? Like, it's too many. It's too many. At this point, I done lost count. Every day, every morning, I wake up. My inbox, and I'm an advocate. I'm a plastic surgery advocate, okay? My inbox, it's so many of y'all. Y'all just don't understand. Some of y'all be sending me the same stuff from this group. Let me tell you, it's like 50-something groups floating around on Facebook, and I'm only in probably 4 groups. But I feel like I'm in all 50 of them because I get screenshots all day, every day. I get screenshots of text messages. I get screenshots of emails back and forth from Smart. Documentations, conversations on social media, on Instagram, back and forth. Let me tell you, these people not making this up. Some of these people I know personally. It's 2 nurses that had surgery from Dr. Shanklin. So you're going to sit here and say, oh, she gave herself that infection. All of them gave themselves this infection. All of them gave themselves an infection. That's what you want to say. Yeah, we know that this can happen to anybody, but why does it keep happening? At prime example, ain't Dr. Jeff as smart? I'll wait. Dr. Jeff is over there as smart, okay? I have not heard not one infection. Not one. And guess what? Even if he do have one, that's just going to be one compared to 50 in a month. You get what I'm saying? So now it's at the point where I want to do a petition. It's at the point where I want to reach out to the board. It's at the point where I want to get anonymous testimonies. And if they choose to be discreet and want to give out their information or publicly speak, that's fine. That's totally up to them. But if my girls don't want to have a voice for themselves, somebody got to step up to it. And guess what? I'm advocating for all the dolls. I'm advocating for all the dolls at this point because I don't appreciate it's not given. Like, I don't feel like his practice is being concerning. Even with the patients that, okay, you prescribed me some antibiotics, you told me to fly in or come in and see me one time. I don't even want a revision. Why would I let somebody that caused this pain and this scarring to reopen up those same wounds? You get what I'm saying? And then it's still going on. So either Dr. Shanklin is you, or I don't know, is it your sterile techs? They're not sterilizing right after each patient? Because it's like a butcher house over there. It's like a butcher house over there. They just chopping it up. They just chopping them up in and out. And let me tell you one thing about Dr. Jeff. He's not going to take on more than he can handle. This man is following the rules and the guidelines and the protocols. He's not violating any type of rules or restrictions or any of that. Dr. Jeff is doing what he's supposed to be doing over there. Okay, and it's at the point where I've been trying to call over there and call over there. I don't know if my number is blocked, because I'm sure they heard about me. Okay, I don't know if my number is blocked over there, but I highly do want to do like a Zoom interview with the head office manager, or even with Dr. Shanklin himself, or even with Dr. Shanklin's wife. And I just want to lay it all on the table with, and let him know the concernments and what's going on, and how the patients are feeling, and they're not feeling comfortable, and they're not recovering on time like they should. Yes, we all know it can take 6 months to a year to heal, but we're not supposed to be suffering with an infection for 2, 3, 4, 5 months. We're not even supposed to have occurred an infection. Why? Why is all his patients? That's the question. Ask yourself. I understand we have a lot of Shanklin lovers. I get it. You can ride or die with your doctor. That's cool. I get it. And trust me, if he wasn't giving out these infections, I'll still be riding with him too. Not only just giving out these infections, like he's not following up. He's not following up. He'll do 1, 2 follow-up, and then it's like 3 months later, I'm back in the ER. I'm reopened up. The infection, now it's my breast. It's not my breast, then it's my tummy tuck. It didn't reopen on this side. Like, what's going on? Like, what's going on? People don't have money to keep flying in and out of Miami to come see you, sir. Why we just can't get it right the first time? I'm sitting here, I'm doing everything. Half of my cousins that have occurred an infection, half of these people I did consultations with them. Half of them, they've been rocking with me since day one. I have not had any infections. Half of the girls, even the new ones, half of the girls were basically following my footsteps through the journey. They was doing everything they were supposed to do, not getting the areas wet, making sure they stay sanitized, staying hydrated, making sure they walk, making sure that they're not putting extra ointment or any type of ointment on their scarring, you know. And I'm not understanding those type of wounds that they have, that could have not happened at home. Half of these girls, because I'm hearing rumors about it could have been at their recovery house. Half of these people aren't even doing recovery houses. You know why? Because I'm not advertising recovery houses. Because we've been so blindsided. And when I say we, I've suffered from a disaster recovery house too before. My very personal, when I got my tummy tuck. I don't advise people to do recovery houses unless you really, really trust this recovery house. You've been referred to them from a reputable person. You've been following them. You've been doing your research, and you know that you're going to be in good hands. It's too much going on at these recovery houses. They coming in and they shutting them down. They coming in, they kicking you out. You can't cry, or they want to kick you out. They want to charge you extra money if you got rescheduled. They don't want to compromise. They don't want to accommodate. They don't want to do anything but take your money. That's all that they want to do. So at this point, I'm just at the point where I'm not even referring any recovery houses unless I really, really know that they're good. Even when it comes to massages, the people I refer to y'all for massages, they are reputable. These people are reputable. I dealt with them before. I know they're not scamming. The hotels I stay in, they're A1. They clean A1. I have never caught an infection. And I had 3 rounds, and I did exactly what I was supposed to do. And the dolls that was following me, the cousins that was following me from my journey, when I first started, they know exactly what to do. So I'll be doggone if anybody try to come in my group and say that, oh, you sure they didn't get that from a recovery house? Why do they have to get it from a recovery house, sis? Why they couldn't have got it from Dr. Shanklin? At this point, how can you even sit up there and even say something like that? Where's the remorse? And especially for the ones y'all never even had surgery before, but y'all around here proclaiming and y'all Shanklin this and Shanklin that. You never even got cut on before. You just watching in the bushes. We talking about the people that has really put in the work, the people that are really getting ready and getting prepared to have surgery, the people who know, they know some of, now I'm not gonna get you, don't get me wrong, some people know more about surgery than the people that probably have had surgery, because I have a lot of people in my group that have been following me. They've been taking notes. They're doing their research. Even to this day, they've been pushing their dates back because they still undecisive, 1 foot in, 1 foot out, because they want to make sure that they're making the right choice. They don't have to go off of what I say, but at the same time, I'm going to warn my cousins. Whenever I come across anything, I told y'all I keep it raw and uncut. I don't care what doctor it is, because guess what? We have freedom of speech. Now, is it my fault that a lot of people are rescheduling and booking Jeff? That doesn't have anything to do with me. I'm just an advocate for my girls. Okay, what y'all choose to do with the information is what y'all choose to do with the information. But I know one thing for sure, and I know two things for certain. If I had an advocate that's trying to warn me and that's coming on here and telling me what's going on in these surgery streets, and it's not just one, it's just two, baby, I'm going to take heed to that. I'm going to take heed to that. I'm going to take heed to that. Okay, and I'm going to have a wake-up call real fast. I don't care if I done paid in full. I don't care. If I can't switch it to Dr. Jeff, we need to figure out if it's a dispute. I'm about to do something at this point, because guess what? My life will be on the line. And who's to say that you wouldn't get an infection? Who's to say that you will get an infection? You get what I'm saying? And it's a hit or miss thing. I don't like to gamble. You're not about to gamble with my body. You're not about to play hit or miss with my body. We're not about to play them games, especially when you already have a reputation of giving infections. You and your wife. Like, I don't understand what's this going on with his wife. She and I, ever since she came, people getting infections. She's in the room more and more and more. Even one cousin, I think I said this on a live a few months ago. Even one cousin said that one of the administrators at Shanklin's office told her that the wife was operating on her with Dr. Shanklin. Now that makes me wonder, is she doing full surgeries? Because she's not a licensed board certified plastic surgeon. She's not. And also, I want to also tell y'all, if the day of surgery, make sure y'all the day of pre-op, read your contracts. Y'all be in that room with all those girls and y'all talking, especially my Vixen girls, because they're smart. They handle y'all accordingly up there when it comes to pre-op. It's not too many people. I gotta give them that. But at Vixen, pay attention to your contract. Because I know at Vixen, it's like a welfare office up there, okay? I know how it is at the welfare office, baby. Back in the day, I used to be at the welfare office, okay, with my son. So it's big and it's busy up there like at the welfare office. And let me tell you something. If you're not paying attention, you will be skipped over because you're talking. You're not reading that fine print. You just want to get your surgery. But you need to pay attention, because now it's life or death now. We all are taking a risk. Pay attention to the small print. You paying your money and your life is on the line. Okay? So I say this to say, somewhere on that contract, they're supposed to have who's going to be in the surgery room with you as far as the assistants. Now, if their name's not on there, you have the right. You have the right to find out the day of surgery what assistants are going to be in there. What assistants are going to be in the room with you. You have the right to have that information. You never know. You might need that in court. And them people probably don't even be working there no more, because they're assistants. Assistants, they float around. Okay? They float around. So that's why I say this to say, you want to make sure that you have your paper trail. Let me tell you something. I ain't playing with this stuff. I am not playing with this stuff. Y'all can play with it if you want to. It's too much going on. And if they want to keep bringing up Shanklin, he came from Vixen, now he is smart, now people got a lot of stuff to say. What are we saying? I don't understand. What are we saying? We're saying the truth. So if it was Dr. Cannon, what would y'all be saying? Y'all just want to go to Dr. Shanklin because He was the combo king. He's still the combo king. He's still doing them combos, but it's a hit or miss. I'm not even liking his work. Even if he wasn't doing infections, I've been stopped reposting Dr. Shanklin work because I was like, this ain't Dr. Shanklin's work. I've been looking at his stuff the last couple of months. Even before the infection rumors, I had stopped reposting this man. I wasn't even doing no more live reactions. I only did one live reaction video, if y'all haven't noticed. You get what I'm saying? You got to watch how people move. I only did like one reaction video. The rest I was doing like on Triggs. I was doing like on Dr. Jeff. Like, nah. I was doing Zoe over there at Vixen. No, I'm not about to support you. I really don't want to post smart at all. But give or take, I really, really like Dr. Jeff. So I'm posting him. And guess what? Even if I do hear one bad thing about him, I'm not going to stop posting him because guess what? Who knows if that was the doctor's fault? But to continuously have a doctor every week is like 2 or 3 patients keep getting infections. It's not just in my female cousins, my male cousins too. I have 2 that went to Dr. Shanklin. Only one came forward. Only one male came forward. And they posted pictures. This is real life stuff. These people Facebook pages ain't fake. Their Facebook pages ain't fake. They're posting it in the group. Their name and a picture is there. We don't have to scam or spam or do anything in my group. We keep it real in my group. And that's why people open up in the cousins group. We don't go and delete people's stuff. People want to come and post positivity. People want to come and post their experience. That's not being negative. That's their truth. That's their truth. We have a few cousins in the early part of March that went to Shanklin and had amazing results. I'm talking about look beautiful, okay? No complications, no diseases, no infections. But what happened when April, May, June? What's going on? What's going on? And I'm really, really upset because it's 2 people personally, like this made me upset a lot earlier today. I was highly, highly devastated and I was very upset. Like I was deeply in my feelings. I was really in my feelings because these were personal people, like personal people that have been rocking with me since I came to this platform. And they have infections and they're just now really, really opening up. And I've been knowing these people. So please don't ever come to my group saying, making it kind of like, what's that word that people be saying? It's surely not obvious. What word I'm looking for? Coincidence. It's a coincidence, or I wonder why people are just now coming forward. You know why? Just like a lot of people don't come forward and talk about domestic violence. A lot of people don't come forward and talk about HIV. A lot of people don't come forward and talk about rape. Because it takes one person to be a leader and lead the pack and let people feel open and warm and be able to express their feelings and open up and show remorseful and just express themselves. You have to make people feel comfortable, baby. You can't come at people being demanding and hostile and all of that. At the end of the day, all my cousins and my dolls that have been opening up, and not just in my group, I seen it in 2 other groups. People were saying that they had caught infections. And not only that, it's some IV drop. Is it drop or drip? One of them. IV drip companies. It's some recovery houses. They do not want any type of relationship over there with Dr. Shanklin. They don't want to service them. They say that Dr. Shanklin office, his patients, they are high risk. And I hate to say that because Dr. Jeff is over there. So even if you're a Dr. Jeff patient, they don't want to deal with you because they feel like all of smart patients is a high risk. And Dr. Jeff is affiliated with them, just like Dr. Z. They didn't want to affiliate with that man because of what had happened. So, I mean, it all goes hand in hand. I get it. You're guilty by association. But at the same time, I just feel like stop talking down on people that's really real life going through this, that real life has been affected. And it's not just them, it's their neighbor, and then the next neighbor, and then the next neighbor. And guess what? I'm going to advocate for my cousins. Guess what? I'm working on teaming up and trying to book like a Zoom or something with Shanklin over there, and hopefully we can be on live so we can answer all these questions. Hopefully it can be, I'll say maybe like 20 minutes, give or take, if they can, because I know they actual lives, they usually don't be about 20 minutes. I want to say they probably be like maybe 12 to 15 minutes at the most. But even still, it's laws that can be put in place. It's laws that can be put in place. It's things that can be done. You are able to get you an attorney if you have been affected from this process. You can get you an attorney. It's protection laws out there for plastic surgery patients. And they are really taking this seriously into consideration due to the new laws and everything that falls in place with that. Okay? So at the end of the day, I want everybody to stay encouraged, stay positive. Keep negativity out your ear. If you have somebody that's vouching for you, that's supporting you, and that's leaning towards your happiness, continue to keep that person close. Y'all know how to reach me. Y'all know how to inbox me. Y'all know how to reach me. So at the end of the day, we're going to stay encouraged in the cousins group. And whatever needs to be addressed is going to be addressed. We're going to keep on moving forward in this journey. We're going to keep on encouraging each other. Happy healing. And hopefully we can get some investigation going on over there at SMART. Because all of this unconcernment and non-follow-ups and just making people feel like they're a number, no, that has to stop. Stop taking in all these patients in one day, Dr. Shanklin. Start monitoring your assistants, making sure they're cleaning their instruments appropriately. Stop having your wife do surgeries on her own, and she's not a board-certified plastic surgeon. This needs to stop. This needs to stop. And we have to speak up. You all have a voice. Speak up. You do not deserve this. You paid your money to go and have a surgery and come out looking and feeling even more beautiful. But yet you got the short end of the stick. You feeling like the red thing around the baloney. And you should not be feeling that way. You should not be feeling that way. So like I said, we're going to stay encouraged. We're going to continue to heal. And we're going to stay walking in this fate of life, in this surgery journey together. Because I'm here by y'all's side and I'm advocating for y'all. So at the end of the day, like I said, keep positive people around y'all. If y'all new to this surgery journey and you're thinking about going over there to Dr. Shanklin, just know you've been warned. Just know you've been warned. I haven't heard anything about his BBLs. I just know it's a hit or miss with the results. I haven't heard anything about infections with the BBL. But at the end of the day, I wouldn't even want him to touch me. Period. Not my breasts, nothing. I'm highly dissatisfied with the remarks and the comments that I've been constantly getting in my inbox. A lot of the doors are being ignored over there at SMART. They're not returning their calls. They're not returning their emails. They are blocking them on social media. Due to HIPAA, y'all are able to request for your surgery reports. You are able to, because you're going to need that if you decide to go ahead and follow through with the legal part of it. You're going to need all of that. Make sure you keep your paper trail, your receipts, and everything. You're going to need all that information. Where I want to end this video, this was part 2, and I'm done. I'm over it. At the same time, it's shameful. It's shameful. I feel like it's no remorse. I feel like it's no concernment. I feel like it's just, it really breaks my heart. It really breaks my heart. And it's a lot of people that's saying that Dr. Shanklin office reached out to them and want to give them a revision, saying he'll just charge them the $150 for the anesthesia. I wouldn't let them touch back on me. Not even for 50. No. No. You ain't do it right the first time. Why would I go back the second time? Oh, Lord, make it make sense. But at the end of the day, y'all have a voice. And you've been warned. All right, y'all. I want to thank y'all for watching this video. Go ahead and subscribe. Go ahead and thumbs up. Leave your remarks at the bottom if you have anything to say. Remember, everybody's opinionated. I don't block people's comments. Go ahead and write whatever it is that you need to say, whether it's positive or if it's constructive criticism. It doesn't bother us over here. I know we have a lot of people in the bushes. Y'all may be scared to speak up, but I'm telling you, speak up, cousin. Why you don't want to warn the next person? And see, that's probably the reason why the person before you didn't warn you. You get what I'm saying? So it's starting to be like a cycle. We have to break this cycle. We have to break this cycle, and we have to speak up. We paying thousands and thousands of dollars, thousands, to come out what? Back in the ER with an infection? No. Anyways, I want y'all to stay blessed and just stay positive. And remember, you have a voice. All right, y'all, I'm out.
This right here is your protective garment. Okay. This is what you will be wearing right after you get out of surgery. Okay. And they're going to put this on you while you're asleep. But you have to keep this on for your body to mold because you want to have that Coke bottle shape. Okay. This is really tight around this area. Ooh. And it's going to help you. It's going to keep it right? Yeah, I don't even have one on anymore. And this on my body. And it just stayed like that? I wore mine for a year. A year? Okay. That's what you'll be wearing. You have to get used to being in this. I want all the smoke. Okay.
Fuck something up. Better fucking something. I need some drink in my cup. Hey, I'm in the mood to fuck something up.